Channel. So in previous lecture we have studied about the mandible, about the body of the mandible. So in today's video we are going to study about the ramus of the mandible. I again repeat that the mandible is very important from the university exam point of view, so understand it carefully. Clear? Okay, what is ramus? In the previous lecture I have told you that the mandible is made up of the three parts, right, which is having the two rami, okay, and one body surface. Clear? So this is rami which is present on the vertical. Okay, this one is the ramus, this one is the ramus, this one is the ramus. There are two ramuses present. Okay, so I have to see, we are going to study about that it is having the two surfaces. That one is the lateral surface, okay. The lateral surface is what? This one is the lateral surface, okay. This is the ramus of the mandible, we know that. Okay, this is the lateral surface of the ramus of the mandible, and this is the medial surface of the ramus of the mandible. Clear? Okay. Now next thing, that it is having the four borders. What are the four borders which are present? That observe carefully, that here it is having the upper border. So it is having upper border, anterior border, posterior border, and the lower border. So it is having the four borders, two surfaces, four borders, and there are also two processes, SBP, that is two surfaces, four borders, and two processes. 2 4 2, ठीक है ना, दैट इज टू सर्फेसेस है, इसमें फोर बॉर्डर्स हैं और टू प्रोसेसेस हैं. प्रोसेसेस कौन से हैं? दिस वन इज क्रोनॉइड प्रोसेस है, एंड दिस वन इज दिस वन इज द condyloid process. Clear? Is it clear to all of you? Yes. So one by one we will cover the surfaces. Now first thing that we are going to study about the lateral surface. ठीक है? What is lateral surface? क्या होती है lateral surface इसमें? Lateral surface is it is a flat surface. ठीक है? Flat surface होती है and it bears a number of the oblique ridges. इसमें क्या होती है? Oblique ridge पाई जाती है, right? And medial surface represent the following features. Mandibular foramen is present in this medial surface. Let us look on the medial surface. So this one is the medial surface. So here it is a mandibular foramen is present. It lies little above the center of the ramus at the level of the occlusal surface of the teeth. Clear? Very important. Mandibular foramen, it lies above the center of the ramus. It lies above the center of the ramus, and it also leads to the mandibular canal. This is the mandibular foramen. When we go inside into this, it will lead to the mandibular canal. Clear? And which descends into the body of the mandible. ठीक है, इधर से ये mandibular canal जाएगी and it will get open into the mental foramen. Clear? Is it clear what I have said? Okay. Next thing, the anterior margins of the mandibular foramen is marked by the sharp tongue shaped projection. Anterior means इसके ऊपर वाली, that is this one. ठीक है, इसके सामने इधर पड़ी है जो, ठीक है, this is the lingula. Lingula is nothing, it is a tongue shaped projection. ठीक है, lingula is directed downwards. Directed toward the, lingula is directed toward the lingula is directed toward the head or the condyloid process of the condyloid process of the maxilla, mandible. Clear? ठीक है. Now going to study ahead, that is the mandibular groove, mylohyoid groove. What is mylohyoid groove? It begins just below the mandibular foramen. This is mandibular foramen. ठीक है. What is this? pterygoid tuberosity. What is this? Submandibular fossa. We have studied in the previous lecture about this submandibular fossa. Okay, what is this? This is the mylohyoid groove. This is the mylohyoid groove. ठीक है, it begins just below the mandibular foramen. Clear? Mylohyoid groove. Okay, and runs downwards, and it runs downwards and forwards, and runs downwards and forwards to be gradually lost over the submandibular fossa. This is submandibular fossa. Okay, it gradually lost over the submandibular fossa. Now this is all about the medial surface. Now I am going to repeat the concept of the lateral and the medial surface so that आपको कोई परेशानी ना हो बाद में, ठीक है ना. So yes, what is the lateral surface? What is about the lateral surface? It is the flat surface. Lateral surface के बारे में बताएं. It is the flat surface, ठीक है, and it bears a number of the oblique lines. What is oblique line? It is a sharp projection of the anterior border of the ramus of the mandible. Clear? Now we are going to study about the medial surface. What we have studied, that there is a presence of the mandibular foramen. Mandibular foramen continues to mandibular foramen is a little above the center of the ramus, lies a little above the center of the ramus of the mandible. It leads to the mandibular canal, which opens into the mandibular, which descends in the body of the mandible, and it opens into the mental foramen. Clear? Now the anterior and region of the mandibular foramen is marked by the sharp line. ठीक है, this is the sharp tongue-like projection which is called as a lingula. The lingula is directed toward the condyloid process of the mandible. Now mylohyoid groove, it is just below the mandibular foramen, and it runs downwards and forwards, and it gets lost over the submandibular fossa. Clear? Is it clear? Now the next thing that we are going to study about the upper border of the ramus of the mandible. Upper border of the ramus of the mandible, it is curved. As you can appreciate here, this is curved, right? And it is also forming a mandibular notch. Clear? It is also forming a mandibular notch. It is also forming a mandibular notch. This is mandibular notch. Now the lower border is a backward and a continuation of to meet the base of the mandible. This is the angle of the mandible, right? So the base की जो बात कर रहे हैं, this one is what? This one is the base of the mandible. This one is what? Angle of the mandible. This one is what? Mesenteric tuberosity. So lower border, अगर हम बात करते हैं, what is lower border? It is a backward continuation of the base of the mandible. This is what? This is what? This is what? Base of the mandible. So जो lower border है, it is the backward continuation of the basement of base of the mandible, ठीक है, and posteriorly it ends by continuing with the posterior angle of the mandible, ठीक है. It ends by becoming continuous. Posteriorly it ends by becoming continuous with the posterior border of the angle of the mandible. Now anterior border, which is anterior border is what? This one is the anterior border, ठीक है. This one is the anterior border. This one is the anterior border. As you can see here, it is a thin, while the posterior border is thick. Coronoid process. This one is the coronoid process. It is flattened triangular upward. You can see here, this is the triangular upward projection है, ठीक है, from the anterior superior part of the ramus, from the anterior and superior ऊपर वाला part of the ramus. If the anterior border is continuous with the anterior border of the ramus, the posterior border bound the mandibular notch. Condyloid process कहता है कि जो interior border is continuous with the anterior border of the, जो इसका इंटीरियर बॉर्डर है, इट इज़ इन द कॉन्टिन्यूशन विद द इंटीरियर बॉर्डर ऑफ द रेमस ऑफ द मैंडिबल, एंड द पोस्टीरियर बॉर्डर्स बाउंड्स द मैंडिबुलर नोच. नेक्स्ट कॉन्डोइल्ड प्रोसेस, इट इज़ अ स्ट्रॉन्ग अपवर्ड प्रोजेक्शन फ्रॉम द पोस्टीरियर सुपीरियर पार्ट, ठीक है. इट इज़ अ ट्राइंगुलर प्रोजेक्शन और इट इज़ अ अपवर्ड स्ट्रॉन्ग अपवर्ड प्रोजेक्शन फ्रॉम द पोस्टीरियर सुपीरियर पार्ट of the ramus. Its upper end is extended from side to side to form the head. The head is covered with the fibrocartilage. It articulates with the temporal bone. You know that we have studied about the temporomandibular joint, right? So this head will articulates with the temporal bone to form the temporomandibular joint. The constriction below the head, this is the neck in which the pterygoid fovea is present. The anterior surface represents a depression, right? That is known as a this is the neck of the mandible, right? Its anterior represent a depression that is called the pterygoid fovea, as you can see here. So this is all about the ramus of the mandible. In the next video, we are going to cover about the attachments and relations of the mandible and the ligaments and the nerve supplies also. Thank you for watching. Stay tuned for the next video.